Okay, greetings to module number 9. We are studying systems of counseling, and in this module we'll be looking at biblical counseling and addiction. But perhaps that's a misnomer because we're going to look at some secular approaches to addiction treatment, especially inpatient addiction treatment programs. And then toward the end of the module, we're going to lay alongside a lot of biblical wisdom. And central to this is the question, what does a biblical worldview add to addiction recovery? And I think it's great to observe that the 20th and now the 21st century has seen a lot of addiction and a lot of medical and psychological counseling applied to addiction recovery. It's been trial and error, right? It's the application of empiricism and rationalism, but a lot of observation and a lot of recording, a lot of categorization, and there's a good value in all this, but we need to really ask, what are we missing? So their worldview starts with their epistemology, which is empiricism and rationalism, sometimes intuition, but of course you can't do much with that. Intuition is difficult to repeat, but empiricism and rationalism is their worldview, and it excludes biblical revelation. It denies the existence of a creator, or it minimizes the presence of the creator and his revelation about himself and about mankind. Whatever you do in a field of addiction treatment, your understanding of reality, your values, we might share a value or two, like recovery is the value. The purpose of a human being, we might not share that. But I think that almost every person involved in addiction recovery would acknowledge that there is value, and you have to affirm value for human beings. Teleology, what is the purpose of mankind? What's the destiny of mankind? And those very things are missing in someone who's an addict. They don't have a sense of self-value. They don't have a sense of purpose. One of the common factors in addiction is kind of the factory job syndrome, repetitive, meaningless work, and so a person will seek relief from that emptiness by drinking or drugs. And then eschatology, I think, also really important, because what you see as your ultimate destiny and the destiny of the human race, again, can create a tremendous void inside of you. And so there's a corruption of ethics that leads to the breakdown of the will, and a corruption of ethics that results in someone being completely helpless in their addiction. And of course we live in an age of more and more sophisticated addictions. So we believe in the authority of the Bible, the sufficiency of the Bible, the revelation of the Bible regarding mankind, and especially in the description of what a person is. very important as you interact with secular humanism on the one hand, and perhaps Buddhism on the other hand, which is pantheistic, and a person is God and God is a person and we're the all in one. And ooh, if you're addicted, you're not doing very well, considering that you're a God. So sanctification, how does a person grow? And again, we've made this assertion that that the Bible and the spiritual life as described in the Bible is a key to personal growth. How does a person grow? They grow through the transformation of their souls as they interact with God's Word and the Holy Spirit and others, and ultimately with God Himself. And counseling is more or less one-on-one, personally assisted sanctification. And then, whose job is it to counsel? I think we'll get after that, especially in the next module, where we'll talk about the church as a counseling center and what that looks like. The church is a sanctification center, and therefore it's a center of counseling, whether it's a large established church with a building and offices or a small group sitting around a table. Still. So we're going to describe the problem, we're going to consider systems of counseling, non-biblical, and we're going to consider biblical counseling. So what I like to do, especially because I live on an island where there's no physical library, perhaps at the University Polynésie Française, but most of their stuff is in French and Tahitian, not helpful for me. So I have to do research online. Sometimes I'll borrow a book, sometimes I'll purchase a book, and sometimes I'll go to websites and really assess if what they have there makes sense. And it's just an element of where I live that I have to do research this way. But theaddictioncenter.com, I think, has a, and I have to say this just right, for a non-biblical group, they have some good descriptions. Now, anytime you exclude God's revelation in the Bible, you're missing the wisdom of the Creator regarding humanity and their problems. So it's going to fall short, but as I mentioned, it can be helpful. So what does therapy for addiction treatment do? And they have the following. It provides the individual with education regarding their addiction, relapse, and the recovery processes, and helps them learn about healthy coping and communication skills, as well as how to build and establish a supportive recovery network. Okay. Notice that what they're saying here is that therapy is education, and their epistemology in that education is basically the accumulated knowledge of biology, medicine, and psychology. And they've accumulated knowledge, accumulated wisdom, tabulated their failures and their successes. And their conclusion is that the individual will receive an education and learn how to cope and communicate in a healthy manner, and to build a supportive recovery network. I think some of these things are good, but if you're missing hamartiology, you're missing a lot. Treatment can help heal shame and guilt and build trust and a positive self-image. I really think that these are good observations. I think the Bible would support this shame and guilt, and that you have to heal it, but the Bible has a very specific way that, first of all, shame and guilt serve, and then shame and guilt are healed. And they have a broader understanding of why the Creator built our souls and our consciences in a certain way. So I think it's good to have broader. Furthermore, it helps a patient explore motives, triggers, and warning signs for substance abuse they may not have been aware of. So again, it's education. And motives and triggers, close to being the same thing, but triggers just a little more specialized kind of motivation. And warning signs. So you inform them about why they're motivated to act out in their addiction. And then by uncovering the root of addiction, patients can better understand the value of getting treated in a supportive facility. So this is their bias, and we're not going to say it's good or not good to go into a treatment facility. It may well be that. It may be a wise thing to do. I'm not sure it's a universal, that depends on some things, but it may indeed be the wise thing to do. So this is what therapy for addiction treatment can do. Same source, approaches to therapy. A lot of these will seem very familiar to coming right out to you, coming right out of our early modules where we talked about approaches to therapy. Behavioral therapy, cognitive and dialectical behavioral therapy. Dialectical is kind of a fancy word for interaction in a group setting. CBT, cognitive behavioral therapy. You may recall the problem is you're not thinking right, so we teach you to think right. I can apply that with biblical revelation, and it comes out fairly well. Creativity-based therapy, they suggest. Art and music therapy, therefore. There is physical therapy, and so there's biofeedback therapy and EMDR, eye movement desensitization and reprocessing. And this is a form of physical therapy. They're still studying it. It's been around for maybe 40 years, but it's had a great deal of success, and I've heard anecdotally from people who have undergone this, and they've done well with it, especially for processing trauma, EMDR. You may want to remember that and see whether it's available if someone's really having an issue with trauma that's giving them nightmares and flashbacks and that sort of thing. EMDR can be helpful. NAD therapy, which is kind of a specialized infusion of vitamin B3. When I say infusion, I mean intravenous through an IV. And it's just supposed to really nourish the body at a cellular level and get everything working extraordinarily well. There's experiential therapy, that is animal therapy, adventure therapy, art therapy, or music therapy. So the people at the addiction center will interact with animals like horses or dogs, or they'll go rock climbing, they'll paint paintings and listen to or create music. So holistic therapy brings many different things together. And then motivational enhancement therapy, boy, these people are just like theologians. They have to come up with their specialized jargon for what they're doing, and it just means you help the individual find a good motive for staying sober. And so, um, going over these things, cognitive behavioral therapy helps to make the patient aware of the impact of their thoughts and actions by teaching them mindfulness. Patients learn how to pay attention to the quality of their thoughts and how to positively alter them. Practiced as early as 1905, this therapy type helps to reduce anxiety, symptoms of eating disorders, obsessive thoughts and behaviors, and symptoms of PTSD. Dialectical behavior therapy helps to boost self-esteem of patients and may offer support for behavior in group settings by providing validation. DBT also combines elements of CBT, offering individual therapy and in some cases motivational enhancement therapy. And I want to say something about group therapy for addictions. It's been observed, like through Alcoholics Anonymous and other organizations, that it's good to be with a group of people who suffer from the same affliction. You hear people tell very familiar stories of how they stumbled into or went headlong into addiction, the kinds of things they've suffered, the families they destroyed. But it creates a group of people who are saying, we're all here for the same reason. And it's a good kind of support where you're saying that person's like me, they're doing it, I can do it too, and so there's kind of a group momentum with that, and also just group encouragement. It's people who have gone through and are going through what you have. Motivational interview or enhancement consists of helping people find their inner drive to accomplish a goal. And naturally, your motivation has to exceed your addiction. And so the licensed therapist listens to the concerns of the patient, finds encouraging ways to get them to commit to change. Helps patients who struggle with depression gain a sense of focus. One thing about being depressed is you really lack motivation. And so it can be combined with other kinds of things like CBT for better results. Now we shift to emedicinehealth.com. What are the 4 components of addiction? And I think it's good to get a medical viewpoint of this. I think there's a biblical viewpoint that we'll be looking at later on in this lesson or in this module, but get a medical viewpoint. Now, there's a key reason to have the medical viewpoint, because you as a Christian, you as a pastor, you as a professional counselor may be interacting with medical professionals. So it's good to understand the ground. It's good to understand the terrain, and it just makes it better. You know, I've been in my career as a pastor into treatment facilities from time to time, done interventions, all kinds of things. So it's good to understand what medical professionals are talking about, but it's also good to understand general observations. So, number one is impaired control, intense cravings or strong urges to use a substance or continue the behavior. Alongside that, failed attempts to reduce or stop using the substance or behavior. So, you're going to swear it all off, and you fail time and time again. This is the day that I'm going to um, stop drinking, stop the drugs, stop the pornography, whatever it is, and you just experience failure after failure to reduce or stop using the substance or behavior. Um, there are associated social problems. So an addict can't stop the behavior, but they also have interpersonal problems with family members, friends, or coworkers. One of my first memories of realizing that that there are alcoholics is that the father of a family in our church was an alcoholic, and he was just destroying his family. It was just completely awful. And he had three beautiful children. He had a lovely wife, and he just failed and relapsed. And of course, this causes disappointment. Failure to complete work, school, or home tasks. So, in other words, their life is spinning out of control. Reducing or quitting social work or leisure activities because of substance abuse or behavior. So, this is, you can't always see the addictive behavior because that's typically done in secret. So, how do you know that someone's an addict? Well, there are some signs. The family starts to fall apart. They start to do poorly at work and school. They are reducing or quitting social work or leisure activities because of substance use or behavior. And if you notice these things, or a friend or family member notices these things, it might be time to open up the conversation. Risky use is a third, use of substance in risky settings, continuation of behavior despite the risks, continued use of substance and participation in behavior despite known harmful consequences. So high is the level of desperation to use or participate in the addiction that you'll take risks. It's just a desperation. Number four, there are drug effects, like tolerance is a major issue, so they need larger amounts to get the same effect. Withdrawal symptoms, and it's different for each substance. Recently, we had a police officer visit us here, and he used the word tweaker, and it's when a person is twitchy from withdrawal symptoms. Addiction may be accompanied by other psychiatric disorders as well, and so you notice these things. For instance, with alcoholism, withdrawal symptom can be delirium tremens, which there can be hallucinations and just all kinds of mental illness manifestations, hallucinations, physical disorders as well. really the life is falling apart. So those are the four components of addiction. Um, and uh, Back to emedicinehealth.com, what causes addiction? Now, these are four major reasons that people begin the journey into addiction. Number one, to feel good, uh, to get high or intoxicated. They just want to feel good. You know, it's the mistake that they make, and it feels so good. It's so happy. I'm exhilarated. And then alongside that, to feel better. So they feel worse. They're all stressed out because of job or home or life in general. Um, they forget problems. They want to they want to get so drunk that they're not obsessively thinking anymore. Soon they'll think obsessively about alcohol, but that's what they want. Or to just feel numb and want to feel better. So it could be because of trauma. It could be they don't know how to handle stress. They don't have a relationship with God. They don't know how to cast their cares on Him. Whatever it is. And then to do better. So many people take drugs for improved performance or thinking. And then number four, peer pressure or experimentation. They're curious. What is it like to take this drug? I remember meeting someone many years ago. Their son had died because he was curious about heroin, and his first experience with it, he overdosed and passed away. Really tragic, right? He was just curious, and he didn't have the discernment to know of the addiction and to know of the destruction. Feel good, feel better, do better, or just curiosity, and there's that deadly peer pressure. Um, People who have problems love company. Misery loves company I think it's a truism. And so they're so stupid they need to have someone come with them on their journey into stupidity and destruction. So feel good, feel better, do better, curiosity, peer pressure, experimentation. But in the end, they just get caught. They're trapped. And it doesn't take long at all. They've got something inside of them that's broken. They don't know how to heal it. With substance abuse, doesn't take long at all. And the life spins out of control. So again, from emedicinehealth.com, they have some suggested treatment options. Now, I do want to go back to our previous slide for just a minute, because we're really, and this course is about systems of counseling. And so I look at this, and they've accumulated data. And this is what science does. They accumulate data. They have the people check into treatment facilities and fill out paperwork and answer the questions, how did you get started in your life as an addict? And so they get all this enormous amount of data because um, the numbers are staggering, if you'll pardon the expression, of people who experiment with drugs. And, you know, in our home country in the United States, it's just unbelievable how many people, underage people, experiment with drugs and alcohol. It's 50%. And they're just sifting through this data, and they come up with these 4 general categories. But I want to say that wouldn't you like to have the wisdom of the Creator? Wouldn't you like to have that? And the perspective of the ages. It makes sense if you're going to accumulate all the data you possibly can. Why just empiricism? Why just medicine? Why just corrupt rationalism? Remember, and I tend to just throw out intuition entirely, but remember that these observations are liable to corruption, that people might lie on their survey forms, or they might miss something, or building rationally and logically from these conclusions or from this survey material, but excluding the divine viewpoint can make it go off. So, suggested treatment options. Hospitalization for medical withdrawal management, that is detoxification. I think I would recommend taking this option very seriously. Therapeutic communities, that is highly controlled drug-free environments or sober houses. Again, I think I highly recommend this. Now, for each of these 2 first ones, there are many that are coming from a Christian worldview, and I would recommend them even more highly, because without the Bible, without the Christian worldview, I think you're seriously shortchanging yourself and your treatment. I want to share this memory that I have of when I was a assistant chaplain in a hospital, and I happened to be placed into the transplant area. I've been through a transplant, very logical. So, but the transplants were liver and kidney. So I would go floor to floor and sit with people who have had those kinds of transplants. And I sat down one time with a man who had had a liver transplant, and I said, well, how can I pray for you? Because this is my way to talk about spiritual things. And he said, pray that I don't go back and do it again. This is my 3rd liver, and I destroyed the first 2 by alcoholism. So pray that I don't go back. And I said, well, be happy to pray for you, but what are you going to change? Where are you going back to? Well, I'm just going back home. And had a very frank discussion with him that if he was just going back to that old place where he was an alcoholic and destroyed 2 livers, he's going to destroy the 3rd. And, you know, I wasn't mad at him, but we had a good, encouraging discussion. And I just said that's the reality. So therapeutic communities can be very helpful. outpatient medication management, and psychotherapy, including biblical counseling, I think. But for treatment option for someone dealing with substance abuse, absolutely. Intensive outpatient programs as well. So all of these things in particular for substance abuse. Furthermore, residential treatment, that is rehab. So we've done the medical side, now we do the psychological side. Also, along with that, support groups are helpful. Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, and so on. Notice they're excluding here any kind of spiritual, but they're just really kind of going with this, pure, empirical, rational. Some people have recovered in this way. It may be that they're just shifting addictions to something less harmful. But support groups, at least they get away from their substance abuse. Self-help groups for family members. Al-Anon or Nar-Anon family groups. So, and these are just self-help groups and support groups. So, again, we're working from a secular viewpoint here, and we're now to psychologytoday.com. 11 indicators of effective treatment. 11 indicators of effective treatment. Number one, assessment and treatment matching. That is, finding effective help for an alcohol or other drug disorder starts with reliable and valid screening for the range of substance abuse disorders and related conditions, as well as physical and mental health conditions. In other words, assessment is smart because there may be drug and alcohol addiction, and there may be trauma involved. There may, there can be all kinds of related factors. So, physical and mental health conditions. Comprehensive, integrated treatment approach is number two. In addition to substance use disorders, patients in treatment may have co-occurring psychiatric disorders like depression and anxiety, as well as other medical problems like hepatitis C, especially for needle users, right? Alcoholic liver disease or sexually transmitted diseases. Programs incorporating comprehensive approaches that directly address these additional concerns or otherwise assertively link patients to needed services improves the likelihood of substance use disorder remission. Again, I'm partially amused by the jargon. Improves the likelihood of substance use disorder remission. So now it's a psychological disorder, like post-traumatic stress disorder and other psychotic disorders. So substance abuse is a disorder now. I think that there has been a long debate about whether addiction is an illness, or as we don't like to say mental illness, we like to say disorder, you're out of order. So among Christians, there's this desire to say, no, it's a sin, and whatever it is, recovery, why not just say recovery? But substance use disorder remission just means recovery. So way too much jargon there. Now, third indicator of effective treatment: emphasis and assertive linkage to subsequent phases of treatment and recovery support. Continuing care is essential to provide recovery-specific social support and necessary recovery support services after the patient transitions from the initial phase of care. So, assertive linkage to subsequent phases of treatment and recovery support. Just transition through the phases. So you go from initial phase, which may be medical, and there may be medical withdrawal symptoms you have to deal with, hospitalization, that sort of thing, and then over to a rehab facility. So programs that strongly emphasize continuing care and that provide assertive linkages, not just here's a name and number to go to the rehab facility, but assertive linkages. The next step in your recovery is going to be this. That's an assertive linkage. Ongoing healthcare providers, peer support groups, recovery residences, they tend to produce substantially better outcomes. Now, I do appreciate this. If someone has undergone some kind of addiction, their likelihood they're going to be depressed, and they're going to have low energy in following through with these kinds of linkages, as they say. And along with that, healthcare providers, community resources, and so on. So I think this is wise. I think this is just application of general wisdom. Number 4, really appreciate this: a dignified, respectful environment. The treatment program should possess at least the same type of quality environment as one might see in other medical environments, that is, oncology or diabetes care. It does not need to contain chandeliers and oriental rugs. It should be clean, bright, cheerful, and comfortable. Creating a respectful and dignified environment can help addiction patients in particular, who often feel as if they've lost their own self-respect and dignity, regain it. So you have to have, it has to be clean, it has to be well maintained, and then also I'm just going to observe that dignity comes from the way that people treat you. And so you treat people with respect. The caretakers treat people with dignity, and in that way they're transferring dignity to them. And the way you treat people can affect the way they think about themselves. So I have a deep appreciation for this. Number 5, a 5th indicator of effective treatment: significant other and family involvement in treatment. Engaging significant others in the person's life in treatment increases the likelihood that the patient will stay in treatment, and that treatment gains will be sustained after treatment is ended. This is a tough one. I mean, often significant others will leave. Family will disengage. And if there are multiple relapses, even more so. But reuniting to the family, relinking to the family can be crucial. I deeply appreciated families that were willing to um, go the distance, not the extra mile. Extra mile, nothing. Go the 1,000 miles. Better yet, go the distance. Doesn't matter how many miles. So, go the distance. A spouse, a brother, a sister, a parent, go the distance. Sixth indicator, employ strategies to help engage and retain patients in treatment. Dropout from addiction within the first month of care is around 50% nationally. Because those who drop out tend to have worse outcomes. Well, yeah. It's vital to employ strategies to enhance engagement and retention. In other words, be aware they're going to want to drop out. Create an atmosphere of mutual trust through clear communication and transparency of program rules, regulations, and expectations. Also, by providing empathic counseling and motivational incentives that reward patients for continued attendance and abstinence reductions in substance use. Seven, use evidence-based and evidence-informed practices. Sounds like empiricism, right? Programs that deliver services founded on scientific research and principles and that are delivering the available best practices tend to have better outcomes. In addition to psychological interventions, these should include accessibility to FDA-approved medications for addiction. I'm not going to try to pronounce all these, but methadone is one, naltrexone, acamprosate, there I did okay, as well as psychotropic medication for other types of psychiatric conditions, SSRIs, and etc. You can do your research on this. So they're saying evidence-based and evidence-informed practices, in other words, do the science and follow the science. I think that there is some merit to this, but there's also a warning. This is only the material side, and once you commit to science and exclude the immaterial side, I think you're really doing some grave disservice to that. So just be, it's okay, but be careful. Number 8, qualified staff, ongoing staff training, supervision. Having a multidisciplinary staff, that is, addiction, medicine, psychiatry, and spirituality. Oh, I just want to put an exclamation point. Spirituality. At last, even from Psychology Today, at last someone acknowledges the immaterial. They can help patients uncover and address a broad array of needs that can aid addiction recovery and improve functioning and psychological well-being. Staff with adequate certification, licensing, or board certification in these specialty areas are indicators of higher quality programs. So, qualified, ongoing training, supervision, retraining. I like all this. I'm going to say one more thing about staff. Addiction treatment is kind of like being a pastor. It has a high burnout rate because of so many people relapse, and of course people have to focus on their victories and so on. But multidisciplinary staff, but also a staff that supports each other, and spiritual support for the staff as well. Um, but good, some good to that. Be careful. Spirituality, at last, at least someone's acknowledging the possibility of the immaterial. Personalized approaches that include specialized populations, gender, and cultural competence. Stemming from individualized comprehensive screening and assessment, programs should treat all patients as individuals, attending to their needs accordingly, recognizing the potentially different needs of men and women and those from different communities like LGBT or cultural backgrounds. So I think this is in part coming from a more progressive background. However, I say only in part because it's really wise to pay attention to culture. There are certain common elements in addiction, and those are I think, revealed in the Bible, revealed through observation as well, revealed through the uncountable number of surveys and data accumulation over the last century or so. But personalized, yeah, everyone's different. Every addict is the same, but you're looking for edges. You're looking for every edge you can, and to be able to relate to them as a person means relating to them in their uniqueness, whatever those may be. Absolutely, needs of men and women, those from different communities, even the LGBT community, or cultural backgrounds. Absolutely, take into account these things. And if you go back to 8 for a minute, respect. So I do want to emphasize this. I don't care what background they're from. Respect them. Aid them to get better. Even if they're involved in egregious degeneracy outside of their addiction. Respect, dignity, and there's this thing called love, agape love, where you want God's very best for them, no matter where they're at. Being personal is important. Next, measurement of program performance, including during treatment outcomes. So further indicator of quality treatment is having reliable, valid measurement systems in place to track patients' response to treatment. Similar to regular assessment of blood pressure at each point of care in the treatment of hypertension, addiction treatment programs should collect addiction and mental health vital signs in order to monitor the effectiveness or ineffectiveness of the individualized treatment plan and adjust it accordingly when needed. So collect data. Make sure that you are not overreacting to data and not disregarding data. Finally, external accreditation from nationally recognized quality monitoring agencies. So accreditation from external regulatory organizations such as the JCAHO, the Joint Commission, kind of an ironic thing for substance abuse. The Commission on Accreditation of Rehab Facilities, the CARF, and the Council on Accreditation, COA, and programs which are licensed by the state tend to have higher quality care as they must contain minimal levels of evidence-based care. So I find myself in an interesting position as we observe these things together. And here's why. I always approached it from the viewpoint of a pastor. I always looked at it from the viewpoint of biblical revelation. And I never got any kind of counseling degree or any accreditation, but I always just tried to be wise and want the best for a person. That included recommending treatment facilities, recommending medical treatment, and so on. I couldn't say that I have a degree in counseling, but I find myself teaching this course on systems of counseling. And I'm not accredited in the sense that number 11 here is talking about, but am I qualified? And I think I am, by my experience and by my knowledge of the scriptures. I say this very humbly. I wasn't always 100% successful, but treatment centers, if they're doing great, are 50% successful. So there are key elements of addiction recovery. And so we're going to go through this, and this is our last section here that has to do with kind of that secular observation, and this is from RDoRecoveryCenter.com. I believe that they're in Utah, and they have assembled their observation on key elements of addiction recovery. And I think we can I'm going to list them, and then we'll take our break and then come back and we'll just pay a little more attention to them. But number one, a sense of self-direction, commit themselves to get better. An emphasis on a holistic lifestyle. In other words, understand the root causes. Consider every aspect of your life. Treatment must be person-centered. I think we encountered that already. And the best type of recovery is strengths-based. Not only to stop using, but increase resilience. Being responsible. It's primarily an inside job that only you can control. Making sure you're feeling empowered, and maybe this is a little bit new agey, but if you feel like your self-esteem is plummeting in a program, it's a major red flag. You should feel powerful that you're winning. Remembering that recovery is non-linear. It's not straightforward step by step. I think this is very wise. We'll come back to that one a little bit more. Evaluating where you stand with others. And so this is the interaction with families and friends and peers, and re-establish relationships. Having a support system who cares. Obviously, you got to have people who care about you and want to help you. So that's going to lead us to what does the biblical worldview add to recovery from addiction, and that's where we'll go in the second hour. Let's take a break.